My name is Dr. Mohammad Mubeen. I am a cardiothoracic surgeon and I am working as a director of Cardiothoracic Surgical Department at Venkateshwar Hospital, which is situated in Sector 18, Dwarka. This is a 300-bedded multi-speciality hospital which caters to all sorts of clinical conditions. And I am here to look after the cardiothoracic and vascular surgical patients. We have 10 modular OTs which are equipped with all sorts of internationally acclaimed instruments, and they are world class. In our cardiothoracic surgical department, we are doing CABGs, valve replacements, aortic surgeries and other complex congenital and vascular surgeries. Recently what we have started is that instead of doing surgeries through sternotomies, which is a standard practice, now we are doing surgeries through minimally access thoracotomy approach. That is why 2 inches incision in the in between the ribs, we can approach the heart, and we are doing all surgeries including bypass surgeries, valve replacements and some congenital heart defects repair through this small thoracotomy incision. And this is called minimally access cardiac surgery, or in shorter form it is also known as MICS. So the advantages of this operation is that as compared to the previous surgeries which are being done through sternotomy, the patient has to remain in the hospital for a longer period of time, 8 to 10 days. In MICS, the hospital stay has shortened, so the total hospital stay will be only 3 to 4 days, like in angioplasty cases where the patient stays in the hospital only for 3 to 4 days. So here also the recovery is faster and the patient can go back to his routine normal life very fast. As compared to the sternotomy surgical approaches, in minimally access patient, they can go back to their normal routine in next 10 to 15 days time. So the duration of treatment, the duration of recovery is faster, and the patient can go back to their normal routine in a much faster way. The other advantage of minimally access cardiac surgery is that what we are doing at Venkateshwar Hospital is that we are taking down both the chest wall arteries. Those are called left internal memory artery and the right internal artery, and we are not taking any graft from the legs. So the advantage of this is that the duration of remaining healthy for a venous graft is only for 8 to 10 years, the life of vein graft, whereas the life of these internal memory artery grafts are 15 to 20 years. So it gives a long disease-free duration to the patient. So this is the major advantage by which this minimally access surgery using both internal memory arteries are done. So another factor about the minimally access surgery is that the pain is less and the blood requirement is less as compared to the sternotomy approaches. So in our Venkateshwar Hospital, in our OT, we have got all the equipment and the facilities to provide this minimally access cardiac surgery. Thank you.